Okay. Assalamu alaikum everyone. I'm Shahad Hammad and this is Samra Mirza, and we will be conducting the GIT OSPE review session for you. So just to orient ourselves, we have our plan for the session. We're going to start with a short OSPE review or a mock exam, and then we're going to go over specific topics with their own respective questions. So we're going to start with the OSPE review. I want you guys to have a little paper or something to write down your answers because we're going to be showing the answers at the end. Each station will get about 30 seconds, like a real mock exam. So you'll be timed for each question and you'll write your answers because we're not going to stop and discuss the answers in between each question. So make sure you're ready and we'll start in a few seconds. Okay, we're going to start. One, two, and three.
Okay, everyone. So that's the final station for now, and we're going to show you the answers. You can have a minute or two to go over these, and then if there's anything that you feel like it was confusing to you or you want us to focus on, then just let us know right now. After this, we're going to get into our explanations for certain topics, and we'll do questions in between. And by the way, you can write it in the chat, or you can write it, or you can like unmute and answer, or anything, whatever you're comfortable with.
Should I check
The
out
third
the
station? Okay, all right, we'll keep it in mind. Okay, so for the third station, that was relating to the arteriogram, so we're going to get into it in a bit. For now, Shahad's going to start off with the upper GI histo, and so
Hello, everyone. So I'm going to start us off with the upper histology of the gastrointestinal tract. It's actually really easy, so you guys don't have to be stressed about anything. There's only a few key points that you guys need to know. So before we get into it, I'm going to start with the general structure of the histology of the GI tract. Typically, we follow a four-rule method where we have 4 layers for every structure in the GI, but this can vary point to point. Some places will have something extra or we won't have something. So just to go over it, we have the mucosa here. This is the uppermost layer. It has the epithelium and the lamina propria. The next layer, submucosa. From the name, sub is below the mucosa. This is where we're going to have major structures like blood vessels, glands. Most of the secretions will come from the submucosa and move up to mucosa. After that, we have muscularis externa. These are the muscular layers. We have inner circular, outer longitudinal. I will explain this later, what this means. And there will be an extra one in the stomach, which we will get to. And finally, we have the adventitia and serosa. I've put a slash between them because, again, it can vary. So starting with the first thing, we're going to start from top to bottom. I will start with the upper GI and some will move to the lower GI. So starting from the first structure, we have our tongue. We have these projections in our tongue, which give us different functions. So we're going to go through about 4. So to start with this, we have the filiform papillae. And the way I remembered this for my exam is frilliform papillae. They kind of look like the frills of a dress, if you can see here. They have these pointy-like projections where you can see on dresses. So if you see these kind of pointy projections, frilliform, the frills of a dress, filiform. So as for the function, we have these ones don't have any taste buds, so you're not going to have any taste sensation. These are also found in the anterior 2/3 of the tongue and not in the back. For the epithelium, this is an important part. They're keratinized stratified squamous epithelium. So if you can see here, if we zoom into the mucosa layer, here we have layers of epithelium from here to here. So this is stratified. They're also kind of flat. You can't really see it from this picture, so that makes them squamous. And here we have a layer of keratin. This is kind of specific to the tongue. You won't see it in a lot of other places. So remember, keratinized stratified squamous epithelium. The function of this, sorry for the misplacement here, is the increasing friction between the tongue and the food. This is going to help keep the food in place and just know the function for friction. Anything else here? Here's the mucosa with the epithelium. Here we have the muscularis for the muscles. And if you guys noticed, this doesn't have a submucosal layer. So keep that in mind. As we said earlier, it can vary the layers. So here we don't have a submucosal level. Remember that. So for the next one, we have fungiform papillae. This one's fairly easy. We know fungi are like mushrooms, so this one has a general mushroom shape. If we start from the mucosa, we have the epithelium. We have stratified epithelium, the same as the one before. And in this one, what's different from the last one, we have the taste buds. If you remember from the last one, we didn't have any taste buds, but here we do have the appearance of the first taste buds. They're also found on the dorsal surface of the margin of the tongue. And what that means, if you stick your tongue out, on the sides is the margin. It's not exactly on the very lateral end, but on the surface, the dorsal surface, we have on the margins of the tongue. I will show a photo later so you can visualize it better. But just remember, if they ask in the exam, it's on the margin of the tongue. So the first one, frilliform for the dress, and the next one, fungiform, mushrooms, fungi shape. After this, we have circumvallate papillae. This is fairly easy as well. Circumference, circle, you get the gist. Here we have a circle, and this does look kind of similar to the last one, but if you want to differentiate this from the one before, you can see here that there's only 8 to 12 throughout the entire tongue. There's only 8 to 12 of these. So if you see this in the exam and you're wondering, is it fungiform or is it circumvallate, you can see in the previous one, there's adjacent structures next to each other. Okay, but in this one, since there's only a specific amount in the tongue, you're only going to see one in one area. You're not going to see them beside each other. So this is something you can use to differentiate. Another thing is that they're located in the sulcus terminalis. I'll show you again a diagram what that means, but it's basically in the posterior of the tongue, and these are found anterior to these in a V shape. They're also associated with Ebner's glands, which produce saliva. And if you go to the photo here, we have our stratified epithelium. Here's our mucosa. And at our submucosa here, we have our serous glands, and they will secrete secretions for the tongue. Now for the intermission, we have the structure of the tongue. As I said, I would show you. Here, we have our sulcus terminalis, which was at the posterior of the tongue. And over here, we have the circumvallate papillae. As you can see, they're arranged in a V shape at the sulcus terminalis. And here we have the fungiform, which we said were on the margins of the tongue on the dorsal surface. And here are the filiform. The fungiform and filiform will be interspersed on the tongue together, while the circumvallate will only be in this area. So that's it for the tongue. We're going to move down. Oh, that's not it for the tongue, sorry. We have the last one, the foliate papillae. These don't have, I couldn't think of a mnemonic or anything to remember them by, so anything that doesn't look like the last ones we just described is going to be foliate because it's the last one left. So these ones are kind of like towers. They're just parallel to each other, and they have these clefts in them. So if we zoom into these clefts, we'll see these structures here, and these are the most important things that you have to know. These are the taste buds. So food will come here, you'll have your taste buds, the whole physiology story. And that's what you need to know about the foliate. Next, now we're done with the tongue. We're at the esophagus. So this does look like there's a lot to work with here, but we're going to go step by step. So when you have your esophagus with nothing inside of it, it's going to be kind of collapsed on itself. So that's why we see these ridges here. But when you have food coming down your esophagus, it's going to be stretched out and it's going to be straightened. So here we have the ridges. We're going to zoom in. And here we can see our mucosa, our submucosa, and our scleraris. So for the epithelium, we have stratified squamous here. And here we have the submucosa, sorry, my bad. So here we have the submucosa, we have the glands. And here we'll have the mucosa, and we have our different types of muscles. We have the ICOL, which is inner circular, outer longitudinal. And what this means is that the inner muscles more closer to the lumen are arranged in a circular pattern. So you're going to see circles. And on the outer muscles, we have longitudinal. And this is because since it's a cross-section like this, it's transverse, and we have the muscles in a certain arrangement. If it were a longitudinal cross-section, they would be opposite, but you don't really need to get into that. So just remember, inner circle, outer longitudinal. Finally, for the most outer layer, we have the adventitia. We don't have serosa yet. That will be in the lower side of the GI, which Samra will get into. So we have the adventitia, inner circular, outer longitudinal, and the glands in the submucosa. And don't forget stratified squamous epithelium. Moving on, we have the esophagogastric junction. This is where the esophagus meets the stomach. So I got this from your lab committee files, and you can see that they've put a division between the two structures. The only thing we need to point out here is the difference in the epithelium. We have here our stratified squamous epithelium, but when we move here, we only have simple columnar epithelium. It's more columnar for more secretions in the stomach. And another thing we can point out is that the stomach has a thickened muscularis externa. This is for increased paralysis, moving the food around, digesting, and everything. So that's the main topics you need to know about these slides. Next, we're moving on back up from the junction. I will get to the stomach later, but we're moving back up to the glands. So we're going to start with the parotid gland. This is right here. I've inserted a photo. So for the glands, you do need to know the type of secretions, what these cells look like, and you also need to be able to differentiate them from each other. So if we start here with the parotid gland, we can see these types of lobules. They're a circle of cells, and they are called serous acini, and they secrete a watery-like fluid with proteins in the form of zymogens, which will get activated later on. So for the parotid gland, you need to remember there's only the serous acini. There's also here, as you can see from a bigger view, we have the capsule. This is also kind of special to the parotid gland, as the others, not all the others, but some of them won't have it. We also have the septum. These are kind of like invaginations of the capsule, and they'll be dividing the parts of the parotid gland. For the next one, we have just one more thing. We're just zooming into the glands, so you can really differentiate them from the others. You'll see the other one in a moment, but these are the serous acini. Next, we have the submandibular gland. As you can see here, the glands already look kind of different from each other, but we still have our serous acini. But here we have mucinous acini as well. These will secrete mucus into the mouth to help with lubrication and other types of things. So to recap everything that we've said so far for the gland, the parotid gland was only serous secretion. Meanwhile, the submandibular is mixed serous and acinous. So we're going to have both serous fluid and mucus in the secretions. This one also has a capsule, though it's not as visible here. So keep that in mind. Next, we have the sublingual gland. This is in this area. If we zoom in here, we can still see that there's a mix of glands, but this time it's mostly mucinous. So you need to really hit that in stone, the types of glands that you have in these different areas. So we have the mucinous acinus, but no fibrous capsule. Be able to make that distinction. And these are opening at the base of the tongue. So one more time, we have the serous secretion for the parotid, mixed for the submandibular, but mostly serous. As you can see, it's taking up more space, and mixed for the sublingual. Now we're going to go back from the junction into the stomach. So here, if we zoom into this part here, we can see that the stomach has different folds. These folds are to increase surface area, more absorption, the whole story. And these are called rugae. So these are to help you with absorption. So if we zoom in here to the epithelium, we said that it was simple columnar. So there's more secretions, more absorption, more everything that you need in the stomach. If we go to the submucosa, here we have our blood vessels. We're also going to have some glands here. And for the muscularis, we can see that there's slight difference here. We have 3 layers instead of 2. Before, we only had the circular and longitudinal, but now we have an extra one, which is the outermost oblique. And here we have the circular and the longitudinal. That's it for this part. We also have the crypts, which will also have some different glands in them. You don't really need to get into that, but just know the epithelium and the glands. Another zoom in for the stomach, we have these specific cells. I doubt they're going to ask you to identify the cells since they kind of look similar to each other, but you should know their functions. And if they tell you the cell, you need to be able to tell them what it secretes. So here we have PC, which is the parietal cells or the oxynitic cells. They secrete hydrochloric acid digestion. Over here, we have the NC cells or the mucous neck cells. These secrete mucus from the name. Here we have the CC or the chief cells, which secrete pepsinogen and gastric lipase. So these ones are generally lower than the other two, so just keep that in mind. Finally, we have the gastroduodenal junction. This is where the stomach meets the duodenum. There's not much to point out here, except for there's a change in glands between the stomach and the duodenum, which are called Brunner's glands, and the secretions drain into the crypts of liver. You just have to memorize that, sorry. One more thing, the pancreas. So we have an exocrine and an endocrine part for the pancreas. The endocrine part will be the islets of Langerhans. Meanwhile, the exocrine parts will be these ductal systems called the centroacinar cells. These start within the acinus and they secrete pancreatic juice. So we can see them here. Try to remember their structure. They're kind of circular with a very pigmented pink with their nuclei also around. And I inserted another picture here so you can see the difference. The exocrine portion is a lot more pigmented, a lot darker pink. Meanwhile, the endocrine portion is very light. Here we have our islets of Langerhans, which will secrete the insulin and everything we know about that. Okay, so before we go on, we have a few questions about the histo. So we're going to follow the same format we did just at the start. It's only a few questions compared to then. And then we're going to move on to another portion. So again, get ready with your devices or whatever you're using. We'll give you 30 seconds for each question and the answers at the end. And if you have any questions, you can ask. Okay, so we can start. 1, 2, 3. Okay, so here are the answers. We'll give you guys a minute or two to check your answers. And if you have any questions, you can just type or unmute. And then we'll move on to the blood supply. Okay, so since there's no questions, we're going to move on to the next part. And I give it to Samra,
Okay.
the blood supply.
So we're gonna go to blood supply first, and then later we'll come back to lower GI. I hope that's all right with you guys. It's just to switch it up so you guys can revise multiple things at a time. So the major stuff that we need to know for the GI, the one that's very confusing for people at times, is from foregut, midgut, and hindgut, right? I'm leaving the tongue out of this because it's very simple. It's just the ones on the sides. So the foregut is essentially, we'll come here first. Okay, the foregut essentially constitutes of your esophagus, your stomach, and a part of your duodenum, right? And so for the foregut, we have the supply of the celiac trunk. And the celiac trunk emerges at the level of T12, which is the same level that the abdominal aorta crosses through the diaphragm. Then we have the midgut, and this is the midgut is supplied by the superior mesenteric artery, and that arises at L1. And then we have the hindgut, and that is the inferior mesenteric artery that comes from L3. It is good to know these levels. Just remember T12, L1, and then L3. So we'll start with foregut. Again, I mentioned foregut is the esophagus, the stomach. It also includes the liver because of the blood supply is also going there, the spleen, part of the pancreas, and all the way till the major duodenal papilla, which marks the ending of the foregut. So the foregut is supplied by the celiac trunk, which is a branch from the abdominal aorta. The celiac trunk gives rise to three main arteries: the left gastric, the splenic, and the common hepatic. Now, there are some stuff on the slides, like on your lab committee files, which were really nice, by the way, but they were labelings of the arteries on the cadavers. Now, that's very good to know, albeit I don't think that they're going to ask you about them in the OSPE themselves, like to label it on the cadaver itself, because it can be very confusing and you have to look around and you don't have 30 seconds. You don't have 30 seconds and more to do that. You have less time. So what they usually do is they will like point at a structure, like maybe they'll point here and they'll go label the structure and then label like 2 arterial blood supplies for this structure. So that's what you're supposed to know, and that's why it's better to know all the arteries and where they're going. So for the left gastric artery, or for the celiac trunk, sorry, the celiac trunk gives off the left gastric artery, one of the main ones, right? And this goes here and it supplies the lesser curvature of the stomach. So here you can see that this is the lesser curvature and then this is the greater curvature. So it's supplying the lesser curvature of the stomach. That's the left gastric artery. Then you have the splenic artery, which is around here, which is this one, and this has many branches too. So you can follow along with it here, and it's going posterior to the stomach, and it's going all the way to the spleen, and it's going to supply the spleen and also the posterior aspect of the stomach. The splenic artery has 2 main branches, the short gastric and the left gastroepiploic. Now, epiploic just means something that's related to the omentum. Now, what's the omentum? Omentum is just a fold of the peritoneum. So when we just say epiploic, we just mean something relating to the peritoneum in general, because that's where its pathway is going through. So again, short gastric and left gastroepiploic. So their paths, if you want to see them. This is what we said our splenic artery was. If you follow along here, and you come here. This is our short gastric artery, this one around here. And then it comes down here, like the pathway is now here, and you can see our left gastroepiploic, because this is the left side, this is the right side. That's the splenic artery. The celiac trunk, sure. Okay. So here they said that this is the, one second. This main thing, like this portion of the aorta, is the celiac trunk, and it's giving off its 3 main branches, which we said are the left gastric, the splenic, and the hepatic. So I hope that's clear. Thank you. Okay. So here again, back to it. For the splenic, we have the short gastric artery on the posterior surface of the stomach, and then we have the left gastromental or epiploic artery, which is this one. So again, lesser curvature is supplied by the left gastric artery. The posterior aspect of the stomach and the spleen and part of the pancreas is supplied by the short gastric, and the greater curvature and around this area it's supplied by the left gastroepiploic. Then we have the common hepatic artery, and from the name you can tell that this is going to go towards the liver and organs on this side now. So we started from the left side and we're moving to the right side. So for the common hepatic, it has 2 main branches. This is the common hepatic right here. It has 2 main branches, which is the hepatic proper, and then the gastroduodenal. We'll come to it on this side. Okay. So common hepatic starts around here, and it gives you 2 main branches. 2 are going up, and like one is going up and it's giving 2 branches, and then one is going down. The one going down is going to be called pancreaticoduodenal. So from its name, it's going to go to the pancreas and to the duodenum, particularly the starting first part of it, the one before the duodenal papilla. And it's going to supply it. Now, when it's superior, you know that there's an inferior as well, but the inferior is going to be from the superior mesenteric artery and not the celiac trunk. So here we just have the superior. The superior has anterior branches and posterior branches, and same for the inferior, anterior and superior, anterior and posterior branches. I hope that was clear. One more time. Pancreaticoduodenal has the superior, and it also has an inferior, but this comes from the superior mesenteric artery. And then the superior has 2 main branches, which are anterior and also posterior. I hope that cleared it. Okay. And then now we did the pancreaticoduodenal part, we're going to go to the hepatic part. So you have the hepatic proper here, which is coming from the common hepatic, right? Now the hepatic proper is going to give you the left and the right hepatic arteries. And the very important one is this one, because the right hepatic artery gives rise to the cystic artery, which is supplying the gallbladder. Sorry, I hope this isn't distracting us too much, but again, you have the hepatic artery proper, which gives you the left and right hepatic arteries. The right hepatic artery gives rise to the cystic artery. Okay, so before I move to the superior mesenteric artery, was the celiac trunk clear to everyone? Okay, lovely. Now we're going to move on to the midgut. The midgut is supplied by the superior mesenteric artery. So this is everything from the jejunum, the remaining part of the duodenum, to the jejunum, to the ileum, to the colon, and from the colon we mean specifically the ascending colon and the proximal 2/3 of the transverse colon. So all the way till here, the majority of the transverse colon, except the left part over here, which is going to be by the IMA. So again, we mentioned we had the superior pancreatic or duodenal artery. Now we have the inferior one. Then we also have jejunal and ileal branches because it's supplying the jejunum and the ileum, so we can just immediately tell that there's going to be jejunal and ileal branches. Now this is what gives rise to the arcades and the arcades and the vasa recta, and this is an important thing to note. Vasa recta, again, vasa means vessels, recta means something that's straight. So this is our straight part, and this is our straight part here, the vasa recta, and the arcades are they're arc-shaped, right? For the jejunum, the arcades are fewer and they're larger, and the vasa recta are long. So you first have a long section of the vasa recta, and then you come down, and then you have the arcades. So that's the jejunum. Again, longer vasa recta and fewer arcades. For the ileum, the vasa recta run very short compared to the jejunum. And then because the vasa recta ran short, there's more room for arcades, and so they're large. So there's a larger quantity of arcades with shorter loops because they're smaller compared to these ones. So that's part done. And then we have like 3 main arteries other than the jejunal and ileal. So we have we follow the pathway, right? So this is like our ileum coming here. Then we have here, there's a junction called the ileocolic junction between the ileum of the small intestine and the colon of the large intestine, or ileocecal junction, between the cecum of the large intestine. So this one that's supplying this junction is going to be called the ileocolic artery. And then we have, as we're moving upwards, this part is going to be supplied by the right colic artery because we are on the right side. So right colic artery. Then once we are at the transverse colon, this is like the middle between the right and the left. So it's the middle section is going to be supplied by the middle colic all the way till the proximal 2/3. So that's where this would stop. Another thing to note is that the cecum has a little extension at the end, and this is essentially the appendix, right? We remember that in anatomy, and this is an important point to note, that you have the tinea coli on the cecum, and then these tinea coli essentially converge at one point to give you one little appendage, and that's called the appendix. And this is supplied by the appendicular artery, which comes as a branch, which is here. It comes from a branch from the ileocolic. And that's the midgut done, I think. Yeah. Is the midgut clear, or is there any point that you would like me to go over? Clear? Okay. If at any point you need me to stop or go back, just let me know. And then we're going to move on to the hindgut. So we said superior mesenteric artery done. And now we're going to move on to the inferior mesenteric artery. Remember that the level for this one was L3. And now the inferior mesenteric artery is a lot easier. It just has 2 main branches that you need to know. That's the left colic to supply the remaining 1/3 of the transverse colon. And then this part all the way here till also like the descending colon and the transverse 1/3. And then you have a sigmoidal artery, which is going to supply the sigmoid of the colon. And then for the rectum. Now the rectum has 2 main supplies. It has the superior rectal artery that comes from the inferior mesenteric artery, but you also have other branches like middle rectal artery, inferior rectal artery, and these ones come from the internal iliac artery. So that's different. But these are the main ones that you need to know for inferior. Again, just to show you, you have left colic, It's supplying part of this and it's supplying the rest of this. And then you have the sigmoid, the S-shaped part, which is going to be supplied by the sigmoid artery. And then the rectum, this proximal part of the rectum is going to be supplied by the superior rectal artery. And that's pretty much it for hindgut. Now, there's something called marginal artery. So essentially, you can see that there's like a pathway forming between all the arteries and where they're entering into the colon. So this marginal artery is like a connection between all of them. And this just allows for collateral circulation in the case of like any blockage or anything. So it's just making sure that in the case that one of the branches are having difficulty, they're narrowed, or something's wrong with the supply of any of the arteries, it's just going to ensure that you have collateral flow to supply that tissue still. So that's a marginal artery. It's just like a collateral supply that's of the connection from all of these arteries because they are also anastomosing with each other at different parts and all that. But that's just the basic concept of it. You just need to know what it is. Okay. And then before I move on to the portal circulation, is the hindgut clear? Okay. Okay, lovely. So I'm just gonna do a quick little review session with you guys. So can anyone, name like three branches, name the three branches from the celiac trunk. You can do it in the chat, or you can unmute, whatever is comfortable. Left gastric, splenic, and common hepatic. Lovely. You guys are doing a really good job. That's it. Perfect. And then one more question. What is the difference between the jejunum and the ileum in terms of the vasa recta and the arcades? Okay, lovely. You guys are spot on. That's really good to know. Okay, so now we're going to move on to the portal veins. The portal vein is a very important clearing system, and this goes all the way to the, good job, that's correct. It's going to go all the way to the liver, and it's going to be a direct supply from the from the intestines to the liver. And so they are formed from the inferior mesenteric vein. That means they're draining the colon. Sorry, they're draining this part of the colon. And the inferior mesenteric vein is going to go and end up at the splenic vein, which is supplying this portion, right? So you have, sorry, here is the splenic artery. The inferior goes here and it enters into it. So they're converging at this point. And then the superior mesenteric, which is supplying this entire thing, joins at the splenic artery, and together they form a convergence again. And this is your portal vein. And this enters the liver, and then the portal vein eventually ends up in the IVC and it carries the blood back to the heart. So what you just need to know is the pathway of how the portal vein is forming. Again, splenic vein has the inferior mesenteric enters the splenic vein first, and then the splenic vein converges with the superior mesenteric, and they give rise to the portal vein. And now we're going to go into angiograms, which are really fun. So this is a celiac angiogram, so it's showing the upper parts, mostly the foregut on the side. So what you need to know, so you can see this really, thick part over here. So this is your celiac trunk, number 2. And so now, again, this is our right side, and this is our left side. The right side has the liver and part of the duodenum. The left side has the spleen, the pancreas, the stomach. Why I'm writing this is to help you orient yourself to the angiograms. So we have the common hepatic artery, right? That's number 3. So you can see that this is the one on the right side. So this one is the common hepatic artery, right from the celiac trunk. Then, now we said up is liver and down is duodenum. So the branch that's going up is going to be the hepatic artery proper, and proper because it's going to divide more. So this is our common hepatic artery proper, and this one is our gastroduodenal over here. And the gastroduodenal artery, can anyone remind me where the gastroduodenal artery comes from? I hope you guys are typing. Yeah, lovely. And as you can see, it's right here as well. So it's coming from the common hepatic, and the gastroduodenal goes down and it's supplying the duodenum. Then we follow again the hepatic artery proper, and we can see one branch is going on this side to the left, and one branch is going to the right. The right one is giving a further branch, this one, and this is our cystic artery, which supplies the gallbladder. Then we are done with the right side, so we're going to move on to the left side now. From our celiac trunk, now we have one part that's going up and one part that's forming these little convolutions. So the part that's going up, and then it's gonna, you can't see it clearly, but it's gonna essentially trace all the way down here. That is our left gastric artery, which is gonna be supplying the lesser curvature of the stomach. And then this part that's forming all the coils, and they're just coiling around like this is our splenic artery. It's gonna go posteriorly. It's gonna supply the posterior surface of the spleen and of the stomach. And yeah, that's about it for this angiogram. Is this angiogram clear to you? Start with your face. Is this angiogram clear to everyone? Okay, because I'll test it in a bit. Before I begin to test you guys, we're also going to do one more angiogram, and now this is on the lower side, right? And you can, before I begin labeling the arteries, I want you to see that you can see these little bubbles forming. This is essentially our colon, and you can see it here. So arrange yourself according to this. We know that this is our transverse colon on the side, and everything in between is the small intestine. So now we can begin. Starting from the top, we're going to have our superior mesenteric artery, and the superior mesenteric artery has multiple branches, as we said, right? So there is one that's going like here. Sorry, there's one that's going here, right? The number 3 over here. And you can see, if you look closely, you can see little arcades forming, and you can see the long, like, you can see these long sections, and then you can see little arced structures forming, and that's our jejunal branches. And also, like, right next to it over here is our ileal branches, and you can see the arcades forming. That's why you can tell if something is like a jejunal branch or if it's a colic branch. So we can see again, as we mentioned, the jejunum is at the top part over here and the ileum is at the bottom part. So you can see that this is our jejunal artery, and the one below it is our ileal artery. And then we come here and we see this one, and this one's going down here, and it's going directly to the bubbles. So this is our right colic artery, which is going right to the colon. And then if we come lower, and again, can someone tell me what the right colic artery supplies? Ascending colon. Perfect. Thank you. So yeah, that's where it is, and it's going towards the ascending colon, so you can see that that's what's going to supply. And at 5, we have it here, which is at the beginning of the bubbles. And that's our ileocolic artery, so that's going towards the ileocecal junction. And then towards the end of it here, we would have our appendicular artery. And that's pretty much it for this angiogram as well. If you have any questions, again, let me know. No questions? Okay, I'm assuming there's no questions, so we're gonna just start testing you. Just gonna zoom in on this one. Can someone label, let's see, 8 for me? Artery number 8 on this angiogram. Splenic artery, perfect. Can someone label artery number 3 for me? Common hepatic, yes. Okay, this one's done. We're gonna move to this one. Can someone tell me which one from 3 or 4 or 6 is the jejunal branch of the superior mesenteric artery? Okay, and what is 6? What is artery number 6? Right colic. Very nice. And can someone tell me what is artery number 2? Okay, lovely. And what is the level that superior mesenteric artery comes out at from the abdominal aorta? Nice. That's so fast. You guys are so good at this, mashallah. Okay, that's about it for the angiograms. I'm just gonna quickly go back to the question that someone had previously asked regarding the regarding the mock OSPE that we did at the start. Sorry. Okay, here. So we said here that we wanted them to label, this is an angiography, as they said in the question of the celiac trunk, and they wanted you to label A and then B, and then ask you which one is closer to the left atrium. So this is a question from unnamed sources. We will tell you later what the unnamed sources are, but they're unnamed sources, very important sources. And their answers for these, like essentially they're saying that this is where the celiac trunk is starting off from. And this artery here could either be the celiac trunk. It's not an esophagus, actually, weirdly enough. This is, according to them, this is an angiography of the celiac trunk. Here, where they're saying is the starting of the, what's it called? I don't mean here, like, I mean, this is probably the esophagus, yes. I mean, like, on this side, this is, from what I can understand, the arteries, and on this side, on A, is either the beginning of the celiac trunk or the left gastric, and because the left gastric is going to come off from the celiac trunk, it could be either. So it's safe to write both. So you would probably just write celiac trunk and then arrow left gastric artery. And then B, as you come lower, is the, which artery was this? And then B was this one, which is our hepatic artery proper. And again, this is just from the unnamed sources, and this is what it is according to them. So it's just safer to know these in general, but they said that this is our hepatic artery proper that's running on the side. And this is not an esophagus, actually, now that I look back at it, because it's not going to be this high up. Again, this is most definitely, according to them, the celiac trunk, this entire thing. And starting off at the top part, we're going to have our either starting of the celiac trunk or the left gastric artery. So like this, and this part over here, according to them, is the this is the common hepatic, and they said which part is closer to the left atrium, and so that's part B. And what I'm gonna do is I will ask someone from them what they meant by this question, and I'll just send a message through announcement chats to you guys through one of our seniors. If that's all right with you. It doesn't make any sense to anyone. But again, these are very important unnamed sources. I'm going back to unnamed sources.
Past papers.
But this is what they had. Just memorize it. Inshallah, it won't come like this. Probably, maybe they'll bring better questions. Hopefully, but if it does, this is how they answered this question. Yeah, I don't know what else to say for it, honestly. But yeah. So we're gonna give you guys a break to just pray Salah, and then we can come back and we will begin on lower GI, and then also anatomy. If that, I do agree with you for this question. It is a very odd one, and it doesn't make sense. From our time, I remember someone making sense of this diagram, but if you are in the exam and you get something like this, I hope you don't, but if you do, then it also just looks very similar to the esophagus, as you said, and these could just be the constrictions of the esophagus at the 4 different points that we know of. Just C6, C6, T4, T12, and there's one more. Where's my notebook? Cute. Which was at the levels of C6, T4, T5, and T10. So it could just be those because we can't see the vertebra behind them. So it could be that the past question is wrong. Again, I'll confirm with the senior if I can and try to get a message to you guys. But it does look very similar to the esophagus. So it could most definitely just not be an artery. Just cancel this question for now. we'll pretend that this doesn't exist, and I hope you guys don't get anything like this. And now we'll move on to lower GI histo. Do you guys have any questions before we begin that? I don't see anything, so we're just gonna begin. So I should mention that the layers of the GI are essentially like the four general ones: mucosa, submucosa, muscularis, and then serosa. In the case of intestines, it'll be serosa. And the structures within them can vary based on like where you're at. And then because of that, it can help you in identifying the specific part that you're on. So we'll start off with the duodenum. And the duodenum has an epithelium of simple columnar. So, I mean, you can't really see it from here, but I mean, if you want to zoom in on this, maybe further than this, but essentially, you know from lab that these ones are the simple columnar cells that we have for the duodenum. Now, they also have villi, and between the villi, like on top of them, sorry, you have microvilli, and this is to increase the surface area for absorption. Other than that, you also have goblet cells. And you can't really, again, see them very clearly in this picture, but they're the lighter colored ones, and they're here. And then for the duodenum, the very, very important structure are Brunner's glands, which are these, and these exist in the submucosa. So if you see these, if you see a duodenum and you see submucosal glands, they only exist for the duodenum, and you'll be able to tell that this is the duodenum and not the ileum or the jejunum. And they do bring questions like these sometimes, from what I remember. And the muscularis is very simple. It's just inner circular and outer longitudinal. And then other things here, zoomed in. Now you can see the simple columnar cells from this. And then this top part that's lining this here, these are called the brush borders. So these contain the microvilli on top. And this little like gap as you zoom in, like these are called our crypts. And this is where the glands like release their liquids into. And that's where the submucosal glands also empty into at some point, the crypts. And then we move on to the jejunum. And the jejunum, again, it has simple columnar, it has villi, microvilli, and then you can notice that their crypts, like the ones that are down here, they also have little cells called Paneth cells. These are our Paneth cells at the end of the crypts. They're these little sections of like highly pink cells amidst the like very like white goblet cells. A very important part for them. You can see the mucosa here, and you can see the submucosa, and you can notice that there is no gland anywhere here. Should probably remove the markings. There is no gland in the submucosa, as you can clearly see. There's nothing here, so you can easily tell that this is the jejunum, and the jejunum also has, sorry, here, the plicae circularis. So these are different from rugae in the sense that rugae in the stomach usually can flatten based on distension, but the plicae circularis never do. The Brunner's glands, sure. The Brunner's glands are here. You can see that this entire like lightly colored structure is a submucosa, and then in the submucosa you have like these glandular sections, and these are for the Brunner's glands, and they're darker colored. And if you zoom in further, you can't from these pictures that were available, but you can tell that they have like little ductal openings. Is that all right? Okay. For the jejunum, again, their submucosa has no Brunner's glands, and their muscularis is again inner circular and outer longitudinal. For both of these, the serosa is very simple. It's just the normal, it contains the blood vessels, and so on and so forth. They very rarely ask about it, from what I remember. Moving on, I showed you the Paneth cells. You can also notice that the goblet cells are like heavily packed in the jejunum. Like as you move along the small intestine, the goblet cells increase. And then we come to the ileum. Now, the ileum also does have plicae circularis at some point, but they're not as pronounced as they are here on the jejunum. And another thing to note is for the ileum, they have something called Peyer's patches, and these are existing in the mucosa, and they can sometimes protrude down into the submucosa. So this entire like dark purple layer is our mucosa, and in here you can see these little sections, and these are our Peyer's patches. There's more pictures of these No, not here, but I think you can find them more in your own lab committee files. I do recommend going over those right before your OSPE. You can even print them out and keep them with you and go over them. But you can, even from this like picture here, you can see that it's like a light colored purple, and then in that purple you have a dark outline for something first, and then inside it again a lighter colored structure. I'm going to remove my markings, and then you can notice them for yourself here. And these are our Peyer's patches. Again, no Brunner's glands. These are only for the duodenum, and the muscularis is the same all throughout. Is this part clear to everyone? Okay. Then we begin with the large intestine, and we'll start with the appendix. So the appendix, again, is like a little appendage from the cecum itself. So its epithelium is going to be very similar to the large intestine that we'll get into. But the important thing to note is that it has a very large quantity of goblet cells, and the very distinguishing factor for them are lymphoid nodules in the submucosa. So this is our submucosa, and these are the lymphoid nodules that are existing in the submucosa. Now we can say that, oh, the submucosa of the duodenum also has glands, and how can we differentiate? You can know that there's no villi available anywhere here. So you can see like this is the mucosa for the small intestine, and it has no villi. So you can immediately cross out any part of the small intestine from this. Then you move down and you can see that the submucosa has these little white structures, and these are our lymphoid nodules. And then the muscularis externa is the same thing, inner circular, outer longitudinal, and then that's the stress serosa there. And again, note that if you look at the goblet cells, like they're immensely packed, like there's a larger quantity of goblet cells as you move throughout the GI tract. I'll ask you questions at the end. Large intestine or the colon itself. You can see that the colon, again, there's no villi, albeit there are microvilli, but they're like very irregularly arranged. So you won't see them very clearly, and you won't see them throughout the colon, but you'll see them at certain points. You can see this little like pink outline over here at specific intervals. Those are the microvilli lining the large intestine. Again, it does have crypts, and the crypts for the large intestine go all the way deep. Like we noticed that for the small intestine, the crypts were like here, and they'd come at some point and they'd stop around here. Or like for the duodenum, again, they're like coming at certain points and they're stopping. But for the large intestine, they go all the way towards the end, and they're like packed between them. So again, their crypts are available, and as we mentioned, goblet cells are increasing as you go lower in the colon. Then the submucosa of the colon. So it has Meissner's plexus, and this is not something you can see on the thing itself. This is just like a feature that you should remember, and they could ask you about it. They could say, list 2 characteristic features for the slide shown below. So you can say that there's a galt present, which we mentioned here, which is just lymphoid tissue. This is gastric-associated lymphoid tissue, and they're present here. Or you can mention that there's Meissner's plexus in the submucosa, and you can also mention that the muscularis externa, which is, it's not present in this picture, but it contains Auerbach's plexus or myenteric plexus. And these are, again, just like features that you can't specifically see on the slide itself, but these are just features that you need to know off the top of your head at any point. Then we have the large intestine, part of the rectum. So here we are going to see like the largest quantity of the goblet cells, because again, as you go deeper, the goblet cells increase. And so these are the most goblet cells present. And then the muscularis externa again contains the inner circular, outer longitudinal, and myenteric or Auerbach's plexus. And then now we're going to move from the rectum to the anus. So we're going to have the recto-anal junction. And here, again, you're going to notice a change in the epithelium. So you're going to see a change from simple columnar into stratified squamous. And then I'm sorry for the picture quality. I generally can't show it here, but let's see. Okay, this is part of our colon and the rectum. This is where the junction's forming. Here, the cells are simple columnar, and as you move towards the junction, you'll start noticing that it's becoming stratified squamous instead. And then we have the internal anal sphincter on this side and the external anal sphincter on here. And so the internal anal sphincter comes from the inner circular layer of the muscularis externa, while the external sphincter layer comes from the skeletal muscle on the outside. And that's pretty much it for the rectoanal junction. Is the rectoanal junction clear? Okay. If there's any questions, you guys can ask. Just okay. Sorry for the interruption, guys. We're gonna move on to the biliary apparatus now. So we're gonna cover the liver. So the liver looks very distinct when you look at it in the pictures because it's as you can see from every other histo slide that we've shown you, it's not this packed with like these type of colors and everything here. Here in the center, let me see if I can zoom in. You can see a very slight opening in this white section, or even here or here. And this is a central vein. This is a vein opening into the liver. And then surrounding them, these little portions, like I don't know if it's that very clear on the slide, like from what you're seeing, but there's a pink in the whole slide, and then there's a darker purple on these sides. It's like this. It's slightly darker, but I don't know how visible this is to you. Okay, lovely. But so that darker side is your portal triad. So this contains the hepatic artery, the common hepatic artery. This contains the bile duct, and this contains one more structure that I will tell you. Or maybe I won't tell you, and you guys can tell me what's in the portal triad. Portal vein. Lovely, thank you. Thank you for answering that. So yeah, the portal triad consists of the common hepatic artery, the bile duct, and the portal vein. And then we move on to a closer picture. So here you can see the central vein and the opening. And then from the central vein, you have this pathway here, and this is our sinusoid. Surrounding them are the liver cells, the hepatocytes in general. Now, Kupffer cells, they're not very likely to bring Kupffer cells and ask you to label them on the diagram, for what I remember. But if they ask you for any classical features, they just have a larger nuclei compared to the normal cells. That's not very visible on these, in my personal opinion, but they just have a larger nuclei and the cells appear more foamy. And that's about it for Kupffer cells. And again, this is our portal triad. This is our portal vein in the center. To the left of the portal vein, you have the hepatic artery. And on this side, you have the bile duct, and then again, another bile duct. And again, I don't think they'll specifically ask you to point them out from what I remember. They might just show you this diagram and ask you what is this structure, and it will just be the portal triad. And then the last part is the gallbladder. And the gallbladder has a very simple histo from my opinion. It's simple columnar, and it's just like this, simple columnar epithelium, and it doesn't contain any villi, it doesn't contain any rugae. The submucosa is very simple, as well as the muscularis externa, and then it just has a cirrhosis. So there's nothing distinguishing about it other than the fact that it's just very, very simple. It's just a normal epithelium, and that's about it. And that is lower histo done. Do you guys have any questions for lower histo at all? Like anything you want me to show, any differences that you want me to go over again, anything? I agree. I don't like GI histo. So there's nothing, no questions? And we're sure? If we're sure, then we're gonna move on to anatomy.
Hello again. Okay, so I want you guys to know that the majority of the things that we're explaining are in detail are the things that you guys asked for on your form. So, yeah. The final part, not the final part, actually, there's more, but next we're gonna go to the anatomage. This is honestly, it's a really enjoyable part, but like before an exam, I understand it can't be enjoyable. So the things that you need to know from the anatomage is you need to be able to identify which level that you're looking at. They might ask that in the exam. You need to know the structures and their related anatomy. They might ask questions about the anatomy. So it's really a very integrated part. So we're going to go through it step by step. Inshallah, it'll be fine. So we're starting from the top here at T8. Honestly, since T is the highest one and it doesn't have a lot of GI structures, I don't think they're going to bring it. But to be safe, we still have to discuss it. So this huge structure right here is the heart. So that's the dead giveaway for T8. You're going to see the heart, you're going to think T8. It's very high up. We don't have a lot of structures here. On this side here, we have our two lungs. And we have our inferior vena cava at 12 and our aorta at 13. So if you see the heart and the lungs, you're going to think T8. It's very simple compared to the rest of the ones. Next, we're going to go to T9. We're moving down a level, and you can see now that we don't have the heart on this side. We've moved on, and we have the liver. Starting from left to right, we'll go. We have the liver here. We have the inferior vena cava within the liver. We can see a bunch of branches here where the blood is draining into. On this side, we still have our lungs. Don't be mistaken for anything else. This is still the lungs. Over here, we also have the right lung. The reason why this part is more disproportionate than this part is because we have the liver. It's a very large organ and it's going to be pushing against the lungs. So that's the only reason we see like two different shapes. So no heart. And now we have over here, we have our stomach. This is the very top of our stomach, so we're not seeing inside yet. Over here, as I said, this is the inferior vena cava, and here we have the aorta, and here we have the esophagus. So as soon as you see the lungs, liver, stomach, you're thinking T9. We still haven't gotten to a lot of GI structures, so don't worry about it, but still be knowledgeable about it. A question they might ask is if they pinpoint at point 3 here, they might ask you what the structure is and what are the possible constriction sites. So you need to know the 3 constriction sites for that. T10, the next level, we still have our lungs here. Still, don't be mistaken, it's going very long here across the whole section. We have a very small part on this side. So we have the lungs here. Here's the liver. Again, we have our inferior vena cava. It barely stays in the same place for most of the time. And over here, we have the aorta. Again, we have our esophagus here and the fundus of the stomach. So it's quite similar to T9, but we're just seeing more of the stomach. Okay? Now, this is when our lungs leave. If you can tell the difference between here, the lungs are very dark on T10. Meanwhile, they're a lot lighter. They're not a lot lighter. This is a different structure now. So this is the spleen now. When you see the starting of the spleen, you're thinking T11. So we have the stomach, the spleen, posterior to the stomach. We have the inferior vena cava, the aorta, and the liver. So again, if you see the spleen, you're thinking T11. We've passed T10. Normal lungs, we're past T10. They might bring a question asking you to label this part, and they might ask for the relation of this organ with other organs. They're going to ask maybe what's posterior to it, and yeah, blood supply, nerves, things like that. So going to the next one, we're at T12. This is when things get a little more. We can see there's a lot of structures here, but we're going to go step by step. So there's 2 layers to T12. We have the upper border and the lower border. As you can see here, this huge structure, obviously, we still have our liver. We have the starting of the gallbladder here. Next, we have the appearance of the kidneys. So if we have T11 here and T12 here, you can see that the kidneys are not showing in T11, but they show up in T12. So keep that in mind. We also have the diaphragm, the crust of the diaphragm here. And we have the fundus of the stomach. Is the gastroesophageal junction cardia visible on T10? Honestly, I don't think you can really tell about the junctions since they're just cross sections, but you should know that it is at that level because they might ask for the esophagus and at what level would you have this junction. So keep it in mind. Okay, all clear? Going back, we have the liver again, the stomach here. We have the kidneys. We have the inferior vena cava and the aorta. And again, the spleen on this side. It's quite similar to T11, except we have the appearance of the kidneys and the gallbladder. Now, from the T12 lower border, we're going to see a difference. If we just quickly look between the two of them, we see a difference in this structure. This is the splenic flexure, where the transverse colon takes the ascending colon. The colon takes a bend in the area of the spleen. So we have our kidneys again. Here's our liver, this big structure. Here's our gallbladder, inferior vena cava, aorta, crus of the diaphragm, and again, the splenic flexure. This is the important part for T12, the lower border. And again, we have our spleen, because obviously it will be in relation to the splenic flexure. Another thing you want to take note of here is if we zoom in here, we have our aorta, and we can see a branch coming out from the aorta. Can you tell me which branch of the aorta comes from T12, if you guys remember?
Please remember. I just taught it. Please.
Celiac trunk, yes. Perfect. So 16 is the celiac trunk. In this, they might pin this part and ask you, what is the structure and which branch is it giving off? Or they might say that the celiac trunk is branching off at this point, which level it is. They won't show you the level, so you have to remember this. All clear? So just remember the splenic flexure is what differentiates the upper border from the lower border. Otherwise, everything is the same. Next, we're going to L1, the lower border, the upper border, sorry. The first thing you want to note compared to T12 is that the liver has gotten significantly smaller. So that's what can set you apart from the thoracic and the lumbar parts. So as you can see here, we have our liver, not that distinct. And we have still our kidneys. We have our inferior vena cava, our aorta. This structure here, this pink structure that's crossing the midline, is going to be our pancreas. We have these structures, these tens. These are all the large intestines. If you see anything with this kind of brown substance, which looks like stool, then you're going to think that it's the large intestine. So that's basically it for this level. If we're going to the L1 lower border, this is where we have a lot more things to consider. So again, we have our kidneys. Going by what we know, we have these pinkish orange kind of structures. Before we said crossing the midline, it was the pancreas. But now if you see these orange structures, these are the small intestine. Again, we have our large intestine here, our colon. And we're going to focus on this area right here. So we have our aorta here, and we have the swelling part is the inferior vena cava. But if you notice, we have our renal veins also coming and joining to the inferior vena cava. And if you remember, the right renal vein will directly join with the inferior vena cava. Meanwhile, the left renal vein will have to cross over the midline to join with the inferior vena cava. So you can see that here. We have the swelling of the inferior vena cava here. So the right renal vein comes and joins directly. Meanwhile, the left renal vein will have to cross over the midline to join at this point. Is this clear to everyone? Yeah, I'm going to assume it's clear. Could you repeat, please? Yes, sure. Okay, so here, yeah, okay, clear? I'll clear it and then I'll explain it again. So this is more anatomy than the anatomage, but you do need to know it in case they ask. So here we're on L1, the lower border, okay? Here we have where the renal veins come and join with the IVC. So here we have our two kidneys. Here we have the left kidney, and here we have the right kidney. And here, these parts coming out are the renal veins. So we know from the previous photos that our inferior vena cava was mainly on the right side. As you can see here, we found it here on the right side. On the previous one, it was mostly on the right side. So the same thing is going to follow with where we are now. So this swelling of this black area here is the inferior vena cava. So from your anatomy lectures, you should know that the right renal vein is going to join directly to the inferior vena cava. Meanwhile, the left renal vein is going to have to cross the midline to reach the inferior vena cava. They might bring this in a question where they ask you which one joins or which one crosses, and you'll have to give the number. So you should keep this type of anatomy in mind. Is that clear? All clear. Thank you. Okay, good. Now, for the next few layers, they are kind of low yield since we're not having a lot of differences, but you should still be able to recognize these structures. So again, we have the bottoms of the kidneys. We're starting to lose them here. We have, again, these orange structures we said were our small intestines. So here we have part of the duodenum, the jejunum. Here we have our colons. So we had the ascending going this way, and the transverse, and then the descending here. Okay, and here we would have our hepatic flexure, and here our splenic flexure. For L2, there isn't anything very memorable here. So if they do bring this level, they're mostly going to ask about the abdominal wall here. So as you can see here, they've labeled these areas. So following the little symbols, we have on the outermost the external oblique, then the internal oblique, the transverse abdominis, and then the rectus abdominis. So if they bring this level, they might pin out one of these little symbols and they might ask you which layer of the abdominal muscles are these. So you should remember the order because it's not very discernible on the picture itself. Next, we're going to L3. This is fairly the same. We have our colons, ascending, transverse, descending. We have our small intestines, these orange parts. We have our inferior vena cava, still the aorta, same thing all around. We have here also the small intestines. Going through the next one as well, fairly the similar concept. We have our colon, ascending, descending, inferior vena cava, and the aorta. Okay. And the last level, we have, again, the descending colon, ascending colon, and the small intestine. So 3, 4, 5, fairly similar, just the colons and the small intestine. Meanwhile, L2, the abdominal muscles, and L1, we had the crossing over of the veins. Is that clear? Would you guys like me to go over anything again? All clear. Okay, perfect. It really helps if you go back to the pictures on your own and start labeling at each level. So do that before you go into your exam because it just helps to keep going over the structures and then you'll get the hang of it. So after this part, we're going to go to the mid-sagittal section. The one before this was transverse, we're going mid-sagittal now. We know it's mid-sagittal because we have a cross through the spinal cord. You can see the level of the vertebrae and the spinal cord. And what you need to know from these is the vessels and the organs. So they highlighted this part here. So if we zoom that in, we have here our left renal vein, the one that we said was crossing over the midline to get to the inferior vena cava. Here, 14, we had the superior mesenteric artery, and then right beside that, we had the superior mesenteric vein. So we have these two structures over here. You just need to, I mean, there's nothing to really tell you how to orient yourself with these, so you just have to kind of memorize the relation of these with each other. Continuing from that, we have this big structure here, which is the aorta. And over here, number 6, we have the pancreas and the portal vein. After that, if we zoom out from this area and we come over here, we have our liver. After that, we have our stomach right below the liver. We have the transverse colon over here. And again, the aorta coming down on this side. That's mostly it for the mid-sagittal. Now we're going to go for parasagittal on both sides. So over here, we have parasagittal for the left. We'll know it's the left because we don't see the liver very much. It's mostly the stomach. Meanwhile, the liver is on the other side. So here we have our stomach. Here we have a small part of the liver. You'll see it much more on the other one once I show you. And over here, we have our kidney, our left kidney. Here, we have our transverse colon. Over here, we have the duodenum, or any part of the small intestine, really. Here we have the descending colon, and here we have another part of the colon. So mostly from this side, you're just going to need to know that you're on the left side because of the stomach. You can't see much of the liver. And yeah. Next, we're going to the parasagittal on the right side. Now you can see the difference. The liver is very huge, so that's how you know it's the right side. Again, we have our right kidney. We have the pancreas here. It's going to cross the midsection. We have the small intestines here. We have the ascending colon, and that's mostly all you need to know from the parasagittal. So be able to differentiate right from left, be able to note the organs, the blood vessels from the mid-sagittal. As we said, we have the aorta, the superior mesenteric artery and vein, and be able to orient yourself with the levels on the transverse sections. And that's it. Does anyone have any questions? Okay, I don't think there's any questions. So now I have questions for you. We're gonna go back to our OSPE, and I'm gonna give you a few questions. You answer them on your own. We'll give you 30 seconds for each one, the same thing that we've been doing earlier, and we'll show you the answers at the end. So you can start. Okay, here are the answers. I'll give you guys a minute or two to check it with your answers. If you have any questions, just type it in the chat or unmute. Okay, since there's no questions, we're going to move on to the next portion, which is the ultrasound, and then we have the peritoneum, and then we'll be done. Hold on a little bit, guys.
The ultrasound is very simple and it's very short, so it should be fine. Peritoneum, I'll also just speed through it, and these are again just based on what you guys were asking in the form. So these are the pictures that were uploaded by Dr. The lady who did the ultrasound. And so all you need to know is we have our Mickey Mouse structure here. And okay, so orient yourself. Here is the liver and here's the gallbladder. The liver is more to the right side, and then like this is right and this is left. So this is, and the gallbladder is more to the left. So you need to know that the common bile duct is more towards the right side. It's the one that's like more towards the liver and on this section. And then the hepatic artery, the other side of the Mickey Mouse, is towards the gallbladder. And then the one in the center is the portal vein. And this is just another view of it. Again, this is our liver, and you can't really see the gallbladder in this one, but here is the common bile duct, the portal vein, and then the hepatic artery. And that's literally what the ultrasound is. It's a very easy mark to score in the OSPE, and I hope you guys get this question, and I hope you answer it right. Ultrasound clear? Does anyone have any questions regarding this? Here's also the inferior vena cava, and right under it is the aorta. So first you start with the inferior vena cava and then the aorta. And that's just the general order. There's no specific reason for why we can differentiate those two. Just know that first you'll see the IVC Or you can also see, I guess, the portal vein is going to drain into the IVC. So first you'll start with the portal vein, and right next to it you'll have the IVC, and then under it you will have the aorta. And that's ultrasound. And then we're going to move on to peritoneum. So just like a quick explanation of peritoneum. Again, remember during development, your organs are going to be pushing against something, right? So it's like a balloon structure. And as your organs start developing, they're going to be pushing into the balloon structure. So the part of the organ that's directly pushing in, that's facing this part of the balloon, this is going to be the visceral peritoneum. It's going to face the organ directly. And the outer covering of the balloon is going to be the parietal peritoneum. And that's just it. And this is just, again, to orient ourselves. Now, some organs, they're going to be pushing into the balloon and they're going to be covered entirely by the balloon. So they're going to be called intraperitoneal. Some organs are going to be they're going to be covered from the balloon from some sides. So these are going to, but not fully. Like they're not going to be pushing completely into the peritoneum to the point that they're entirely covered. And these ones are going to be growing posteriorly, and they'll just be pushing at a certain extent. And these are our retroperitoneal organs. For retroperitoneal, there is a mnemonic that was SAD pucker to remember all the organs that are for retroperitoneal. But we'll start with intraperitoneal first. So intraperitoneal is everything that's highlighted purple here. So you have the stomach, you have the first part of the duodenum, you have the jejunum and the ileum. So essentially majority of the small intestine. And then you have the transverse colon only, and then the sigmoid colon and the liver and the spleen. So most of the things that are mostly anterior. And then you have the retroperitoneal organs. This includes your kidneys, your ureters, anything associated with the kidneys, so the kidneys, the ureters, the suprarenal glands. And then you have the rectum, because again, these things are the ones that are more posterior. And then these also include the second, third, and fourth part of the duodenum. So this, because the duodenum's coming and then it's curving around. So the part that's not exactly anterior is going to be covered by, it's going to be covered retroperitoneally. You also have the pancreas and the ascending and descending colon. That's essentially it for the peritoneum and its organs. It's very, very important to know at least like a few examples from each, because they could ask this either in MCQs, SCQs, or OSPEs. Now for these, okay, omentas and curvatures and ligaments. So, okay, so we know that the peritoneum, it's two-layered, right? You have the visceral and the parietal, and the peritoneum is going to be curving at different points. Sometimes it can curve to the extent where there's multiple layers, and so that's what the greater omentum is on this side. So they said that this, so this picture, this is all from osmosis. This looks very clear to show you what the greater omentum looks like. So it looks like they said a kitchen apron, like the ones you wear when you're cooking, because the peritoneum is essentially going to come and it's going to drape forward like this, and it's going to curve back, and that creates a greater omentum, and it's going to fuse with the layers here of the previously covered organs of the omentum of the peritoneum, and it's going to create a four-layer essentially. And this is going to cover, so this entire thing that's covering the colon and the ascending and descending colon parts of it, essentially all the organs behind this. So that includes the small intestine and part of the pancreas as well at some extent. So that's the greater omentum. It's very large. And again, all you need to know is that it's a fold, it's four-layer. And this is not very, very high yield in the exams, albeit they can, like, maybe the wording can throw you off. So it's just good to understand what the omentum is. Other than that, you have the more important part, the sacs. There's the lesser sac and the greater sac. Now, what you need to know because of the sac is essentially it's forming from the lesser omentum over here, and it's everything that's behind, like behind these organs specifically. These are the lesser sacs, and this includes your liver and the area behind the liver essentially. And why you need to know them is because of the epiploic foramen, because we have the lesser sac and we have the greater sac. They won't ask you the content of them specifically, but they'll ask you about the connection between the two sacs. So between the lesser and greater sac, you have a connection called the omental foramen, or the epiploic foramen, or foramen of Winslow. These are the names that it has, and it's just a connection between the posterior side and the anterior side. Posterior is the lesser sac, and anterior is the greater sac, and that's how they're mostly arranged. Now, the boundaries, these are important to know. They can come. The anteriorly, like Anterior portion of the omental foramen includes the portal triad mostly, and the portal triad has been covered by the peritoneum. Posteriorly, like posterior to the greater sac, you would find the inferior vena cava. Superiorly, this is this over here, as you can see where they're putting in their fingers, this is the foramen. We said that posteriorly, we have the inferior vena cava, you can't see it. Anteriorly, like this is our opening, and this entirely covering is anterior. It includes the portal triad. Superiorly, it has the liver, and inferiorly, it has the duodenum. And these are the boundaries that you're supposed to know. And you should just, these are mostly memorization. Hopefully, inshallah, it can just be an easy mark. Just know the boundaries of the foramen. And that's mostly it for peritoneum. Ligaments, there are a few. Actually, wait, I will go over the ligaments for you guys. There is two main that you have to know. And those essentially include, so for the liver, when the liver is bulging into the peritoneum, part of it, like it protrudes through it, and you get something called a falciform ligament. The falciform ligament is associated with the liver. The falciform ligament, where's my pen? Falciform ligament, essentially, like, if this is our falciform ligament for the liver, and this is a covering around it, the peritoneum. The falciform ligament, essentially, it used to have the umbilical vein coming through it as well, but then the umbilical vein degenerated and it left a little opening, or not opening, a little like rounded structure here, and this is called the round ligament, or ligamentum teres. So again, we have falciform ligament for the liver, then you have the round ligament or teres ligament. And this can be pointed in the cadaver. And again, or like a picture, you'll just see the liver and there'll be like something stretching from it, either a picture to show you the stretching part from the liver or like a pin. And it would be the teres ligament. At the end of it, it will be the teres ligament. But if they're pointing at the main body of it, that's the falciform ligament. And then we have one more thing, which is like from the lesser omentum, which is here. This is our lesser omentum, right? It's the same thing that we were covering here. This is our lesser omentum. The lesser omentum has two main parts, and that includes our hepatogastric. Yeah, that includes our hepatogastric and hepatoduodenal, sorry. These are two more ligaments, hepatogastric and hepatoduodenal, and these are just the attachments of where the peritoneum is going from. So it's going to attach the liver to the duodenum at some point, and it's going to attach the liver to the stomach at some point. These are just names that you need to know. Other than this, and it's going to come up in our mock OSPE, you need to know foramens and like pouches, more specifically pouches, more pouches than foramens, but you need to know the pouches, and there's two. There's a Morrison's pouch and there's pouch of Douglas. One is very important based on how deep it is, and you'll see it in our OSPE, it's going to come up. That's important to know. It's also a free mark, and yeah, that's mostly what you need to know for peritoneum. This entire thing, this is the more important part of our like presentation for peritoneum, just know which organs go where. This is mostly just for explanation, just so you can understand the peritoneum and if there's any confusion that you've had remaining from lab. And this is also important. These are just boundaries that you should remember for your MCQs, SCQs, or OSPE, either of those. And that pretty much covers our peritoneum. Does anyone have any questions regarding peritoneum? So no questions? If there's no questions, we'll move on to our final OSPE. How can they test us on intra and retro? They can just ask you to name some. It can be like, maybe they'll point at a structure on the cadaver. It could be the liver, for example. They could be putting a pin on it, and they'd say, like, name some arterial supplies for this first. So you'll mention the right and left hepatic arteries, and then the next part could be state the relation of this organ to the peritoneum, or state whether this organ is intraperitoneal or retroperitoneal. And this can go on for anything else. It can go for the stomach, it can go for the pancreas, the duodenum. They can point at it and ask you. It would be a two-part question, so there was something else first, and then the next part could be that state whether it's intraperitoneal or retro, or so on and so forth. And obviously in MCQs, they can definitely come. It's a very simple MCQ question. Just make sure to memorize this list. It's very easy. And that's pretty much You're welcome. Does anyone have any other questions? Okay. So just getting a pen and paper. This OSPE is just slightly longer. You'll have one rest station in between. But yeah, that's it. And we'll begin our OSPE now. In a minute, I guess. Okay.
If you guys are ready, this is basically the whole comprehensive mock OSPE.
Mhm.
So it'll be including everything that could potentially come in your exam.
Yeah.
So I hope you're ready. We're going to start. 1,
2, 3, go. We're so sorry for this not showing the question, but essentially all you need to know for this one is just state the type of just state the name of the structure, like what are we pointing at? And yeah, that's it. That's all you need to tell us. Like what is it exactly? So this is where the rest station comes in. So we'll be showing you this question, and it'll be like a longer station for you, like around 50 seconds. Okay, guys, so this is the end of the mock. These are the answers to the questions. We'll just show you this page for like 2-ish minutes or maybe less, and then we'll show you the next page, next 2 pages, and those are the answers. If you have any questions regarding these, you can definitely ask us. If there's any other question that you have regarding any other topic for OSPE, do feel free to mention them. We'll try our best to help you out. And yeah.
Okay, guys, so this is the end of the OSPE. I hope you guys benefited from this past session. Again, if you have any questions, we left our contacts at the start of the sites, which will be sent, inshallah. And I hope you guys benefit from this.
Session here. Again, if you have any questions, yeah, we'll upload it almost immediately. Don't worry. If you have any questions, don't hesitate in contacting us. To the second page of answers, sure. This one. Um, Again, for OSPEs in general, they're usually not that hard. They may seem overwhelming at the start, but inshallah they'll be very easy. Again, if you have time in your calling session, in your like waiting station, and just like going into the OSPE itself, print out the slides that you have and keep them and just go over them while you're waiting to be called for your group. And yeah, and inshallah it'll be fine. Again, any questions, don't hesitate in contacting us. Our numbers are at the start, and we'll share this PPT almost immediately. Yeah, that's it. Yeah.
Thank you, guys. Thank
Thank
you.
you.
Good luck on your exam.
Yeah, all the
Inshallah, all
best.
the best.